Hello and welcome to Headline News in Ovarian Cancer from the recently concluded ASCO 2012 meeting in Chicago, Illinois. I'm Steve Highsmith. We have selected various research findings presented at ASCO this year, and we will review highlighted information from those selected abstracts. For a more detailed review of each of the abstracts, we encourage you to please click on the links below this video. The results of two Phase 3 trials were presented on gynecologic cancer, providing new directions for the optimal treatment of women with advanced ovarian cancer. Dr. Eric Pajati-Lorraine, speaking on behalf of the Aurelia investigators, presented results from the first Phase 3 trial combining the monoclonal antibody bevacizumab with standard of care chemotherapy for the treatment of platinum-resistant recurrent ovarian cancer. The 12.6% response rate in the standard chemotherapy group was about what was expected in this patient population, whereas the response rate in the bevacizumab-treated group was significantly improved. The safety profile of bevacizumab was consistent with previous clinical experience. In his discussion, Dr. Michael Seiden of the Fox Chase Cancer Center offered some provocative observations about the treatment of ovarian cancer. He offered the radical considerations of stopping all Phase 3 trials, at least with molecularly targeted agents, deep sequencing the DNA from approximately 10,000 patients, instituting the requirement of submitting genomics data for each patient eligible for clinical trials, and convincing insurers to require the submission of genomics data as a prerequisite of reimbursement. Our second study, pursuing current efforts to determine the best dosing regimen for cytotoxic therapy in the advanced ovarian cancer setting. Dr. Noriyuki Katsumata of the Nippon Medical School, Japan, presented long-term results of a Phase 3 protocol, JGOG 3016, on behalf of the Japanese Gynecologic Oncology Group. The positive results reported in the primary analysis of protocol have held up over time. Women with stage 2 to 4 ovarian cancer were randomly assigned to receive 6 cycles of conventional therapy with carboplatin and paclitaxel, or dose-dense therapy, carboplatin on day 1 and paclitaxel on days 1, 8, and 15. Treatments were repeated every 3 weeks, with responders receiving 3 more cycles. Median overall survival for women with limited residual disease, less than 1 centimeter, has not yet been reached, but for women with residual disease greater than 1 centimeter, dose-dense paclitaxel significantly increased overall survival. Dr. Katsumata concluded that dose-dense paclitaxel improves long-term progression-free survival and overall survival compared with conventional paclitaxel when used in combination with carboplatin for advanced ovarian cancer, and that new strategies should be developed for the treatment of clear cell and mucinous carcinomas. That's going to wrap things up on this edition of Oncology.TV Headline News in Ovarian Cancer at the ASCO 2012 meeting. Remember, if it's happening in oncology, it's happening on Oncology.TV.